Okay. Okay. I'm going to begin by greeting my patients. Hi Kenzie, my name is Brittany. I will be your student nurse today. I'm going to perform hand hygiene. In a hospital setting, I would be providing privacy and explain the procedure. We're going to be performing a head-to-toe assessment. Do you have any questions?
No.
Okay. In a hospital setting, I would provide safety by putting the bed in a low position. She seems comfortable. She's aware. Her eye contact is good. And now I'm going to begin with vitals. First, I would take blood pressure. I'm going to find her brachial artery. When using a blood pressure cuff, I want to make sure that I use the correct size. Put it 2 inches above her brachial artery and feel her brachial artery as I pump into the blood pressure cuff until I can't feel her pulse anymore. This is the number I'm going to begin with when I'm getting her blood pressure, and then go up 30 to 40 mmHgs to find her blood pressure. I'm going to use this number to use her diastolic and her systolic. The normal blood pressure that I would explain to find in a healthy patient would be 120/80. Now I'm going to take her temperature. I would take this orally or axillary, but I don't have a thermometer. The normal range that I expect to find for my patients should be between 97.6 to 98.6 degrees Fahrenheit. Next, I'm going to assess her pulse for 30 seconds. I would multiply this by 2. Okay. I expect to find regular rhythm, 2+, with normal range of pulse being between 60 through 100 beats per minute. While I was doing that, I also assessed her respiratory rate for 30 seconds and multiply this by 2. Right after finding her pulse, I would analyze her breathing position. I expect to find a regular and relaxed position, and it should be about 10 to 20 breaths per minute. Now I'm going to do a neurological assessment. I'm going to be assessing Kenzie's mental status, first by assessing her level of consciousness and awareness. I'm going to ask you a couple of questions. Can you tell me your name and date of birth?
Kenzie, August 14th.
Okay. What's today's date?
November 17th,
What year?
2020.
What are we doing today?
Head-to-toe assessment.
Where are we today?
The hospital.
Hospital. My patient seems to be alert and oriented ×4 to person, place, time, and situation. Now I'm going to be assessing her memory. Again, I'm going to ask you a couple of questions. What did you have for dinner last night?
Mac and cheese.
And for breakfast this morning?
Yogurt.
Okay. She seems to recall recent and remote memory. Assessing her speech, she was very clear and concise. I was doing this while asking her the questions. Now I'm going to assess her 12 cranial nerves, beginning with 1 olfactory. This is a smell test. Please cover 1 nostril and close your eyes. What do you smell?
Vanilla.
Okay, next nostril.
Vanilla.
Good. She was able to identify odor in both nostrils. Cranial nerve number 2 is optic. For this cranial nerve, I'm going to look at the optic nerve with a scope. I don't have one, but I would look in for light reflex. And now I'm going to do a confrontation test to test her peripheral vision. Tell me when you can see my fingers.
I see them. I see them.
Okay. Good job. I'm going to have you look over my shoulder and back to my finger. Okay, next shoulder. Thank you. I also want to note, when testing for accommodation, I want to make sure that the lights in the room are preferably dim. Her cranial nerves 3, 4, and 6 are intact from my test. Next, I'm going to be testing cranial nerve number 5, which is the trigeminal nerve, beginning with her motor function. Can you open your mouth? Placing one hand under her chin, over her head. Try to keep your jaw open. Good, and then just open your mouth up. Good. Her muscles are equally strong on both sides of her face, and she was able to keep her jaw open, and I didn't feel any crackles. Now I'm going to test the sensory function of this cranial nerve. I have a cotton ball, a little sharp screw, and a tongue depressor. Can you close your eyes? Starting with, can you tell me if this is soft, sharp, or dull?
Soft.
Soft, sharp, or dull?
Sharp.
And then lastly, soft, sharp, or dull?
Dull.
Good. She was able to differentiate the difference between soft, sharp, and dull on her sensations on her face. Her cranial 5 nerve is intact for motor and sensory. Now I'm going to test cranial nerve number 7, which is facial. Can you smile? Frown. Puff your cheeks out. Good. My patient is able to puff her cheeks, raise her eyebrows, and show her teeth without any type of restriction. Now I'm going to be testing cranial nerve number 8, which is vestibular cochlear. Can you step in front of me with your back towards me? Okay. Can you close your eyes, please? Please tell me what you hear.
1, 2, 3.
Okay.
1, 2, 3.
Good. You can have a seat. She was able to hear the whispers, and her hearing is intact. Next, I'm going to assess cranial nerve number 9 and 10. Can you please swallow? Okay. Can you open your mouth and say, oh, and say ah? Ah. Good. My patient can swallow with no gagging or choking, and her uvula vibrates with speech. I also noticed that it's midline. Next, I'm going to assess cranial nerve number 11. I'm going to ask you to shrug your shoulders while I apply pressure to your shoulders. Try to kind of resist me. Good. She was successful, did not let me push her shoulders down. Movement is strong, smooth, and she's in control bilaterally. Finally, cranial nerve number 12 is going to be tested. I'm going to inspect her tongue to make sure it's midline. Good. It's midline, cranial nerve 12 is intact. Next, I'm going to assess her motor functions, starting with the strength of her upper extremities. I'm going to also test her range of motion. Good. Can you take your shoes off, please? Can you press against my hand? Good, thank you. Muscle groups in both upper and lower extremities are normal in size, and they're symmetric with no involuntary muscle movements. Full range of motion was noted for both. Next, I'm testing her cerebellar function. I'm going to do this by first testing rapid alternation movement. On your thighs, can you turn your hands quickly? Good, thank you. She was able to perform equal turning with quick rhythm. Now I'm going to do the finger to nose test. Can you touch my finger and then your nose? 3 times. Her movements were smooth and accurate on both sides. Next, I'm going to do heel to shin. With your shoes off, go from your shin all the way down to your ankles. Good, thank you. She's able to move heels in a straight line down both shins. Next, I'm going to assess her gait and balance. You can put your shoes on, and I want you to start here and walk 10 feet in a straight line, heel to toes. Okay, go ahead. And then back on your tippy toes. Good, you can have a seat. She walks freely, Her gait is effortless and she's able to walk in a straight line and be balanced. Next, I'm going to assess her sensory functions. Similar to what we did with your face, I'm going to do this to your arm. Can you close your eyes? Is this soft, sharp, or dull? Soft. Soft, dull, or sharp? Sharp. Soft, dull, or sharp?
Dull.
Thank you. She's able to differentiate between sharp, soft, and dull touch on her arm. Next, I'm going to test stereogenosis. I'm placing an object in your hand. Just let me know what you think it is. With your eyes, yeah.
Cotton ball.
She was able to recognize what the object in her hand was. Next, I'm going to do graphaphasia. I'm going to draw a number on your hand. Tell me what number you feel.
8.
Oh, that's good. She was able to identify the number written on her hand. My next exam is going to be head, ears, neck, eyes, and throat. I'm going to begin by putting my other glove on and inspecting and palpating her scalp. It looks normal cephalic. Okay. I don't see any lumps or feel any lumps, lesions, or tenderness noted. Now I'm going to inspect her external eye structures. Okay. I'm observing the face. She has the appropriate facial expression for her situation. Can you raise your eyebrows? Good. Her eyebrows are equal bilaterally. They go up together symmetrically with expression. Can you blink for me? Good. She's able to open and close her eyes freely, no lagging. Her eyelashes are evenly distributed, and when she blinks, her eyes cover completely when closed. I also see that her eyeballs are aligned normally in their sockets and equal bilaterally to her face. Now I'm going to pull down your lower lid and inspect your conjunctiva. Okay. Pink with no lesions, sclera is white, and looking at the lacrimal apparatus, I see no redness, swelling, or any unusual discharge coming from them. Now, taking my pen light, I'm going to observe her pupil size with my gauge here. 3 to 5 milliliters, correct? They're round, equal in size, bilaterally. I also now want to test your pupillary reflex. Look into the pen light for me. You can look straight to my eyes. Okay. Direct and consensual lighting, the pupils constrict with lighting, and it's positive perla. I assessed accommodation during the neurological assessment of cranial nerves 3, 4, and 6 with dim lighting in the room. Now I'm going to inspect her external ear. The size and shape of her ears are equal bilaterally, and I don't note any swelling or edema. Her ears are an equal height on both sides of her head. Her ear color is consistent with the rest of her face, and I don't see any lumps or lesions on her external ear. Now I'm going to palpate them. I'm checking for tenderness. Do you feel any pain?
No.
Okay. No tenderness noted on a palpation of her external ear. With an otoscope, I would then check the inside external auditory meatus of her ear. I would look on the inside to look for some cerumen or earwax, which is normal. I expect to no foreign bodies or swelling or discharge from the inside of her ear. Normal tympanic membrane is pearly gray, and if I see some white spots, it might be due to from some scarring of past ear infections. My next test is going to be of her neck. Can you turn your head to the left? I'm inspecting her jugular venous pulse, other side. And I see it near her clavicle suprasternal notch. Now with my gloves on, I'm going to palpate her lymph nodes. Starting with preocular, posterior ocular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and subclavicular. Her lymph nodes were soft, movable, and non-tender. I actually didn't feel most of them, which is a normal finding. The following assessment is going to be cardiac. I'm going to assess the carotid arteries by palpating on them one at a time. Can you remove your shirt, please? Actually, not yet. Yeah, right. Carotid arteries up here. Good. Palpation is symmetrical, counter smooth, symmetrical, and 2+. Now I'm taking my stethoscope, which has been cleaned. Using the bell side, I'm going to osculate both carotid arteries. Can you hold your breath while I do this? Okay. I haven't noticed any bruise. Now I'm going to inspect her precordium. Now you can take your shirt off. Okay. Her skin is intact, even, and her skin color is consistent with the rest of her body. I don't note any heaves or lifts. Now can you just lay on your left side? Place one arm to the side like this, the other one across here. And now I'm looking for her apical pulse. Her apical pulse was short with a gentle tap, 2+, which is a normal finding. Good, you can sit back up. Now I'm going to palpate across her pericardium with my fingers at each point. Aortic, pulmonary, Erb's point, and mitral. Good. Now, taking my clean stethoscope, I'm going to osculate her heart, making note of the same points. Normally, I would be osculating for a full minute. I'm starting with my diaphragm and then going with my bell. Everything sounds normal. I don't hear any murmurs or extra heart sounds. Now I'm going to assess her respiratory assessment. Can you turn a little bit here? I'm going to assess the posterior thoracic area. I'm inspecting first. It seems symmetric. I see no sclerosis or kyphosis noted. Her spinous process is straight. Skin color is intact. I'm noting her breathing and respiratory pattern, which is relaxed, and there's no sign of labored breathing or accessory muscles being used while breathing. Okay. Now I'm going to now I'm going to do capillary refill. Okay. Nails seem round, smooth, and clean. Capillary refill was less than 2 seconds. And I want to note that the patient is relaxed and in a comfortable position. Can you please just stay there? I'm going to do tactile fremesis. I'm going to put the palm of my hand on your back, and as I move, say 99.
99, 99, 99, 99, 99, 99.
Vibrations are palpated equally on the posterior chest wall. I don't feel any lumps or tenderness. I felt equal vibrations while feeling. And now I'm going to percuss those 8 points as well. feel normal resonance during my percussion. Now I'm going to take my stethoscope and osculate those same 8 points, and I'm looking for normal breath sounds. Can you breathe in and out, please? Breath sounds are normal and clear bilaterally. The following assessment is going to be her abdomen. Can you just lay flat on your back? Inspecting the contour of her abdomen, I see that it's flat, it's bilaterally symmetric. I don't see any masses. Her umbilical area is midline. I don't see any signs of hernia. I'm looking for signs of skin turgor. Yep, it's good. Skin turgor comes back right away. Now I'm going to take my stethoscope and osculate for bowel sounds. Using my diaphragm, I'm beginning with my lower right side, upper right side, upper left side, and lower left side. Bowel sounds are normal. Now I'm going to percuss over the 4 quadrants as well, beginning with lower right, and finishing with lower left. I don't feel any dullness and tympany. Now I'm going to palpate her abdomen, starting with light palpations in all 4 quadrants. Good. Now I'm going to follow by deep palpations. Skin is consistent, soft, and firm. The surface was very firm, and I don't feel any tenderness. You can sit up now. I'm going to assess her skin. I'm assessing her arms to see any discoloration or lesions or any unusual findings. No lesions noted on the arms or legs. The color is consistent throughout her arms and legs. I don't see any edema. They're all symmetrical, and I see no clubbing of the nails. Okay, now I'm going to inspect the capillary refill of her toes, her lower extremities. Good. Her capillary refill was less than 2 seconds for her toes. And again, I'll just test for capillary refill here. Less than 2 seconds. Now I'm going to palpate for temperature of her feet and legs with the back of my hands. Okay. Her skin temperature is warm and moist bilaterally for both her arms and legs. Now I'm going to pinch her skin on both arms to look for skin turgor. Skin returned to place in less than 2 seconds. I don't note any edema. And now I'm going to palpate all of her pulses, beginning with her radial pulse. Okay. Good. Radial pulses are regular, normal rhythm, and it's 2+. Now, like your blood pressure, I'm going to look at your brachial pulse. Okay. Brachial pulses are also equal bilaterally with a force of 2+. The next pulse I'm going to look for is her femoral. Can you just lay down for me, please? I'm going to press firmly and then release slowly. Okay. Femoral pulse sounds good, or feels good. Now I'm going to do the popliteal. Go. Bending her legs slightly, I'm feeling behind her knee. Okay, and now looking for the posterior tidal pulse on the inside of her ankle. And lastly, for the dorsalis pedis. Good. You can sit down. All her pulses are regular, and I want to note that normally I won't be able to feel the popliteal pulse as much. And that completes our assessment. I'm going to perform hand hygiene. And I will make sure to document all of my findings. Do you have any questions?
No.
Any concerns?
No.
Okay, thank you.